Imagine this scenario. It's a Sunday morning, you've just woken up, and your spouse asks you to grab something from the nearby local bakery. You are still half asleep. As you head to the bakery, you notice some local kids playing basketball. They toss you the ball, inviting you to play. You decide to take a few shots, and just as you're about to jump for the basket, you feel a tearing sensation in your calf, right in the middle between your knee and ankle, and you collapse. You immediately regret not warming up before acting. Did you seriously injure yourself? Will you be permanently injured? Do you need surgery? This is a typical story of middle-aged individuals who suddenly exert force on their calf muscles without a proper warm-up, whether in the gym, on the treadmill, or the football field. If it's not an Achilles tendon tear, which I'll explain further in the video, don't worry, surgery won't be required. However, you might have to endure a few challenging weeks. Will it reoccur? I'll explain that in the video too. The first record of a calf muscle tear appeared in a prestigious medical journal called Lancet in 1884. It was called tennis leg because it was observed in tennis players. For many years, it was believed to be caused by tearing the plantaris tendon, a thin tendon in the calf that doesn't serve a significant purpose. 7% to 20% of the population doesn't even have this tendon. However, this belief has been debunked with the development of MRI and ultrasound. A tear can occur in any of the three calf muscles. In fact, the likelihood of injury to the plantaris tendon, which was believed to have been torn for over a century, is less than 1% of all calf muscle injuries. Moreover, it's now understood that such an injury can result from any sport, not just tennis. The injury is typically noticed in middle-aged athletes when they suddenly exert force on the midcalf, causing immediate pain. It's prevalent among runners, especially those between 30 to 60 years who run as a hobby and aren't well trained. 70% of these patients are male. It's a condition related to the partial tearing of the muscles here, occurring when the knee fully straightens and the ankle stretches backward during athletic activities. It is essential to distinguish calf muscle injuries from complete ruptures of the Achilles tendon, which is the very strong lower part of this muscle. The Achilles tendon usually tears about 3 centimeters above where it attaches to the heel. If you palpate the tendon with your hand, you may notice a lack of continuity in this typical tendon area and feel a gap there. On the other hand, calf muscle injuries cause pain and tenderness in the middle or slightly above the mid-region between the knee and ankle. Swelling can be observed soon after the injury, followed by bruising after a few days. Remember, in both cases, the patient can still walk even if they are uncomfortable. The misconception that one cannot walk if the Achilles tendon is torn is incorrect. The tear often presents as a feeling of something tearing in the calf, followed by pain and swelling. When the patient tries to stand on tiptoe, they experience pain and difficulty, although not to the same extent as an Achilles tendon tear. With minor injuries, the patient might still stand on tiptoe despite the pain. Within 24 hours, edema and swelling in the calf increase due to bleeding between the torn muscle fibers. This clot can dissipate in about a week to 10 days, manifesting as bruises around the calf and ankle. 3 muscles in the calf can potentially get injured. The gastrocnemius muscle is the superficial and posterior one. It is powerful, starting from the heel's Achilles tendon and extending upwards. Before it crosses the knee joint, it splits into 2 and attaches to the lower end of the femur bone, both medially and laterally. Beneath this muscle lies the plantaris muscle, which largely continues as a tendon that crosses the knee joint and attaches to the bone above the knee. Plantaris is very weak as a muscle. If it tears, you won't notice its absence once the pain subsides. These 2 muscles, since they cross both the ankle and the knee joints, are at their most tense when the knee is completely straight, and the ankle is an extension, meaning stretching toward the top of the foot. Naturally, tears occur during athletic activities when they are in this position. Underneath these 2 muscles is the soleus muscle. It forms the Achilles tendon together with the gastrocnemius. Unlike the gastrocnemius, it does not cross the knee and attaches to the bone below it. Therefore, since it doesn't cross both joints, it's less subjected to strain. From ultrasound findings, tears in the medial head of the gastrocnemius on the knee joint's inner side constitute 67% of all calf injuries. When torn, it doesn't sever entirely but gets partially damaged. The chances of fully regaining its functions after healing are high. Oh, let me give a reminder here. An Achilles tendon tear is a problem that can leave a serious injury so that surgery might be necessary. Calf muscle injuries, on the other hand, are much more benign, and distinguishing between the two is very important. In 21% of the patients, although an accumulation of fluid indicating an injury in this area was observed on ultrasound, a significant muscle tear was not found. This means that some muscle fibers have torn here, and since muscles have a very dense vascularization, there's bleeding from the torn muscle, but there's no injury large enough to be detected as a tear ultrasonographically. An actual rupture of the plantaris tendon is seen in only 1.5% of cases. So, in reality, a rupture of the plantaris tendon, believed to be the cause of tennis leg for almost 100 years, is very rare. Tears in the soleus muscle are seen in less than 1% of patients, and even then, only partially. Naturally, this is because this muscle crosses only one joint and is subjected to less strain. Looking at why the tears occur, the types of tears can also vary. Tears in the gastrocnemius muscle, which spans two joints, occur in runners during explosive exercises such as sprints, while the soleus muscle gets injured after endurance training or long marathon runs, manifesting as fatigue injuries more than 24 hours later. You might consider some possibilities, but they're only meaningful if scientifically proven. The primary risk factor is the athlete's age. As age advances, the flexibility of muscles can deteriorate. The second risk factor is a previous calf muscle injury, which can lead to recurrent injuries. Moreover, patients who have previously sustained injuries in the lower extremity like the hamstring, groin, or quadriceps have been found to have a higher risk of calf muscle injury. These two risk factors tell us that athletes who take a break from sports after an injury lose muscle flexibility. Returning to sports without proper training increases the risk of tearing another muscle group. Being at the start of the season and not gaining muscle flexibility is also a risk factor. Gaining excessive weight during the off-season also increases the risk. On the other hand, no associated risk has been found if the athlete is always overweight or underweight, tall or short, or if the injury is on their dominant leg, which they use frequently, or the opposite leg. Being in an intense training season also does not increase the risk. Generally, radiological examinations aren't necessary when considering the typical site of discomfort and the preceding strenuous sports activity. However, MRI imaging is one of the most reliable methods to determine the location and severity of the injury when in doubt. Ultrasound, being a low-cost and easily accessible method, can provide a diagnosis much more quickly. I want to continue the video with a reminder. Doctors diagnose you by examining and reviewing your tests, drawing on a lengthy education process and the experience and knowledge acquired over the years. These videos only contain information that can serve as a reference for those diagnosed by a physician who wishes to research this condition. They cannot be used as a self-diagnosis tool for patients. Such an approach is very dangerous. To avoid delaying a serious health issue due to a misperception and entering an irreversible process, always confirm your ailments with a doctor's examination in a hospital. For this particular ailment, attributing a pain stemming from a blockage in the leg veins or deep vein thrombosis to a sporting activity you did 5 days ago could cause you to miss its real cause and delay addressing it. A calf muscle tear is a common type of injury among athletes and can vary in degrees. It can manifest within a broad spectrum, ranging from a slight tear to a completely torn muscle. Naturally, the treatment varies depending on the degree of the injury. Treatment is usually non-surgical. Rest, ice, compression to prevent swelling, elevation, and painkillers are sufficient. Stretching and exercises during the recovery process are also essential. During the rest period of recovery, the muscle length shortens and loses flexibility. Stretching is crucial to avoid another injury when returning to sports. Surgery is usually not necessary. The muscle doesn't hold stitches, so it can't be sewn, and there's no point in performing surgery on partial tears. The healing time for a torn muscle, unfortunately, varies. While some athletes can return to games immediately, the process can take several months for others. This depends on the degree of the injury. Remember, in some cases, no tear was found apart from the fluid seen on the ultrasound. Calf muscle tear is a common, but often overlooked type of injury. Therefore, being aware and taking precautions will minimize the mishaps we encounter while doing sports. Overloading at the beginning of the season and without warming up the muscles increases the risk. Always remember to warm up before any sports activity. When you look at the risk factors, it's essential not to neglect stretching exercises before and after training that will increase muscle length. May you have a lifetime of healthy and sporty days.